name is Dorothy Fliou. I am a physician assistant, and my topic today is understanding obesity. I'm going to go through some of the commonly asked questions about obesity, but first let's begin with some facts and statistics. Obesity is a chronic disease that increases the risk of other health conditions. Public health experts agree that obesity is an epidemic in the United States and around the world. Overweight and obesity are collectively the second leading cause of preventable deaths in the U.S., closely following tobacco use. According to the World Health Organization, rates of overweight and obesity are still on the rise among both adults and children. Nearly 40% of U.S. adults 20 years of age and older are living with obesity, and approximately 20% of U.S. children and teens ages 2 to 19 have obesity. So the first question we're going to discuss is, how is obesity defined? Obesity is defined as having a high amount of body fat that poses a risk to health. Obesity is determined by your body mass index, or BMI, and your waist to hip ratio. Your BMI is calculated by measuring your height and weight, and it's an estimate of your body fat based on that ratio. According to the CDC, the healthy weight range for most people is between 18 and 25. A BMI below 18 is considered underweight. A BMI of 25 to 30 is considered overweight, and above 30 is classified as obesity. However, it's important to note that BMI does not take into account factors such as your build. If you're an athlete, you may have a higher BMI due to increased muscle mass. This means that BMI is just one piece of the puzzle and not the whole picture. Another important part is your waist circumference. According to a study by the World Health Organization, waist circumference and weight to hip ratio have a stronger connection to disease than BMI. The waist to hip ratio is a measure of obesity that looks at the amount of fat around your waist compared to the fat around your hips and buttocks. Men with a waist circumference of more than 40 inches and women with a waist circumference of more than 35 inches may be at an increased risk for heart disease and other weight-related diseases. The next common question is, what are the risk factors for obesity? One thing that is not always addressed is that the cause of obesity is not simply eating too much. The risk factors that determine obesity can be complex, and there are usually a combination of things that affect a person's weight. The first risk factor can be genetics. Researchers have found that several genes that appear to be linked with obesity. Studies show that the likelihood of developing obesity is passed down through your family's genes. This may affect the amount of body fat you store and where that body fat is distributed. Genetics may also play a role in how efficiently your body converts food into energy and how your body regulates your appetite and how it burns calories during exercise. More research is being done to better understand how genes and lifestyle interact to cause obesity. But considering that family members often share similar eating and activity habits, it's clear that environment and lifestyle also play a crucial role. The next risk factor is metabolism. Metabolism and hormones differ from person to person. How your body uses energy is different from how another person's body uses it. Researchers have found that some people may release more of the hunger hormone, ghrelin, which increases hunger. This is in contrast to another hormone called leptin, which decreases appetite. Thus, all of these factors can play a role in how much weight you gain. Next, there are endocrine disorders, such as certain thyroid conditions that can affect your weight. Also, a condition called polycystic ovary syndrome, or PCOS. This is where the ovaries produce an abnormal amount of androgen hormones, which contributes to these women being more likely to have obesity. There are also certain medications, such as steroids, antidepressants, diabetes, and anti-seizure medicines that can all cause you to gain extra weight. Another risk factor is socioeconomic factors. How much money you make may affect whether or not you develop obesity. People who are poor and of lower social status are more likely to have obesity than people of higher socioeconomic status. This is especially true for women and amongst certain minority groups. Furthermore, avoiding obesity can be difficult if you live in areas with food deserts or areas without safe places to walk or exercise. Sometimes you don't have access to healthier foods or haven't been taught healthy ways of cooking. Other times you do have access to healthier foods, but they may not always be affordable. There are also psychosocial factors. People who are overweight or who have obesity can have problems socially or psychologically. This is because the culture in the US often values a body image that's overly thin, and overweight people are often blamed for their condition. Many of the external factors that affect mood and well-being contribute to obesity. People often crave foods high in calories and carbs when experiencing stressful situations. Thus, emotional eating and when you're bored or upset can lead to weight gain. In addition, sleep disturbances may contribute to weight gain. Not getting enough sleep or getting too much sleep can cause changes in the ghrelin hormone, increasing your appetite. Studies have shown that people who sleep fewer than 5 hours a night are more likely to develop obesity than people who get 7 to 8 hours of sleep a night. Lastly, of course, lifestyle choices also play a role. Overeating and lack of exercise both contribute to obesity. If too many of your calories come from processed foods or foods high in sugar or fat, you will likely gain weight. Likewise, if you don't get enough exercise, you will find it hard to lose weight or maintain a healthy weight. Furthermore, many people in the US have jobs that are less physically demanding. As a result, they typically burn fewer calories at work, especially with the rise of remote work. Even routine daily activities now consume fewer calories thanks to conveniences such as remote controls, escalators, online shopping, and drive-through banks and pharmacies. So the next question is, what are the complications of obesity? Obesity is a complex condition that significantly raises the risk of developing other health issues. Individuals who are overweight or who have obesity are more likely to experience complications such as high blood pressure, high cholesterol, type 2 diabetes, heart disease, stroke, and fatty liver disease. In addition, according to the American Cancer Society, obesity is a known risk factor for various types of cancer, including endometrial, breast, ovarian, prostate, liver, and colon cancer. Reproductive disorders like infertility, endometriosis, and PCOS can also be linked to obesity. Mood disorders, particularly depression, are more prevalent in individuals who are overweight or have obesity. Furthermore, obesity can worsen sleep apnea, gallbladder disease, acid reflux, and osteoarthritis. Okay, so far we have reviewed the statistics on obesity, we know how obesity is defined, and we discussed the risk factors and complications. So that brings us to the final question: how is obesity treated and or prevented? Well, many of the causes of overweight and obesity are preventable and reversible. Obesity is primarily an imbalance between calories consumed and calories expended, though other factors are also involved. So lowering the risk of obesity involves reducing the number of calories consumed and increasing physical activity. Thus, the steps to reaching and maintaining a healthy weight begin with making healthier food choices. This includes following a plant-based diet by increasing your intake of fruits and vegetables, as well as whole grain carbohydrates. Also reducing saturated fats and sugar, increasing your water intake, and managing your portion sizes. Furthermore, it's important to engage in regular physical activity to lose weight and keep it off. The CDC recommends at least 150 minutes of moderate intensity activity a week for adults and 60 minutes per day for children. Lastly, if your BMI is over 35 and you have risk factors or obesity-related complications, lifestyle changes alone may not be enough. In such cases, adding prescription medications may be necessary. It's important to consult your healthcare provider or an obesity specialist to discuss the options that are best for you. So in conclusion, we now understand obesity. We know that obesity has reached epidemic proportions in this country. We've discussed that it is a complex chronic disease that raises the risk of other serious health conditions and complications. And we can prevent or reverse obesity by maintaining a healthy weight, eating nutritious foods, and embracing an active lifestyle. Maintaining a healthy body weight and preventing weight gain is the most effective way to reduce risk factors and prevent obesity-related complications. So be consistent, stay motivated, and remain faithful. Remember the promise in Philippians 2, verse 13, for God is working in you, giving you the desire and the power to do what pleases Him. Thank you.